Good morning. We're just a few minutes out from getting started, getting set up here. We've got several people joining us today. My name is John Green with AMBA. On behalf of the TPEA, we're thankful that you're joining us today on this Friday to talk about dental and vision coverage options. Just a few housekeeping notes whenever Ray's getting settled in here. You'll notice the QR code on the bottom right-hand corner of your screen. You're going to see that throughout the presentation and at the end of the presentation. It's a great way for you to connect to us. If you have questions, want more information about what you've heard here today, want to talk to someone about all of the TPEA endorsed benefits, you can use your camera phone or the camera feature on your cell phone, hover over that QR code. It will pop up a little form. You can fill that form out. It'll come right back to us. We'll take care of you that way. If you're not on your desktop or your laptop, you can, at the end of the presentation, there'll be a place in here that you can have my email address. We can get you started with any questions that you have as well. So all participants today are in a listen only mode. You can use the chat feature or the Q&A feature. If you have questions, I encourage you to get a pen and paper because we're going to show you a couple of sites we want you to go out to, places to compare, things like that. Get a little bit more information, write some phone numbers down, all that kind of fun stuff as well. So we'll get started here in just a moment. Ray, can you hear us?
I sure can. Can you hear me?
You sound perfect. We'll get started here in just a couple of minutes. We usually have a lot of folks who sign on right at noon on their lunch hour. So we'll go ahead and put myself on mute. We'll get started here in just a couple of minutes. Thanks. It's almost straight up noon. It is straight up noon right now, and welcome. Good afternoon to the TPA sponsored Friday Lunch and Learn virtual webinar format regarding the dental and vision coverage options that you have through the TPEA. My name is John Green with Association Member Benefits Advisors, joined by Ray ML with TPEA. We're going to talk about a lot of things legislative, wrap up the legislative session, then jump into some offerings that the TPEA has in regards to dental and vision, kind of compare that to ERS plans. And then we're going to talk about the next several months as we move forward with these seminars. We've got quite a few participants, and we're going to talk about some of the new changes we've got coming. So again, we're glad you're here. Just a couple of housekeeping notes, and we'll get started real quickly. All participants are in a listen only mode. If you want to communicate, ask a question, we'd love to take questions. You can hop on the chat feature or the Q&A feature. We'll periodically pause throughout the presentation and discuss what's going on, any specific questions that you may have, and talk about some issues, things like that. If you have questions, feel free to drop in there and do those things. You'll also notice this QR code on the bottom right-hand corner. If you see something along the way that says, hey, I want to ask about that, or there's a benefit I want to talk about, or I need somebody to talk to me to review my benefits, things like that. If you are on your laptop or desktop, you can take your cell phone, open up the camera feature, hover over that QR code, a little form will pop up, complete that form, send it off. We will have someone contact you right away, make sure that you get any question answered. any discussion, comparison between what you currently have as a retiree or an active state employee or member of TPEA, what's available to you. It's a great way to continue the conversation. If you don't have access to your phone, or you're watching us on your phone or your iPad, at the end of the presentation, my email address will come up and you can send me an email. We'll take care of you just that way as well. So we've got quite a few folks on here today. Ray, let's go ahead and get rolling here, and we'll discuss as we roll through here a little bit, first of all, what TPEA does for you. The legislative session has just wrapped up, but that doesn't mean that the work stops. It doesn't mean that we stop holding our breath, because there are a lot of bills that are on the governor's desk, things like that. Ray's going to cover those in a moment. But TPEA celebrates their 75th anniversary this year. They were formed before ERS. They're designed to protect that pension, whether you're receiving it now as a retiree or whether you're an active state employee and you hope to receive your pension in the future. They're there to design to protect that for you. Their role also is to protect your pay, lobby for funding increases for salaries, to protect the benefit contributions that the state makes on your behalf. And a big thing that the TPEA does for you is, because Ray and Bishop, several of the board members, have worked for ERS or currently work for ERS right now, is to make sure that they understand all the state benefits and identify the things that change from year to year, not only in premium, but coverage levels, things like that, and identify those missing gaps that may impact you as an employer or retiree. And that's what they do specifically for you. So I want to introduce Ray Amell with the TPEA, and he is going to tell us a little bit about, kind of wrap up legislative issues and tell us what the next steps are, Ray.
Thank you, John. I want to thank all of you for all that you've done for the state of Texas during this last year, between the freeze and the various storms and of course COVID. You have done yeoman work. You've been so key to the success of Texas moving forward. So thank you. And we hope we've done some good lifting over the legislature on your behalf. Now, the session has ended, but the governor has promised us that there will be probably 2 special sessions. Those by the Constitution can only last 30 days, and they can only happen upon the call. It's a term of art. The governor sets the agenda for that special session, and we are very hopeful that there will be some state employee issues included in that call, in that agenda. But in the meantime, let's talk about what happened in this particular session that just ended. There were a few hundred fewer bills that actually passed. And of course, some of them the governor has until Sunday night, that's Father's Day, to veto bills or to sign bills into law. And the third way that bills can come into law, by the way, is that the governor can let them become law without his signature and without his veto, of course, without his signature. So far, of the bills sent to the governor, I'm going to talk about some of the bills the governor has signed already. And one of them is a bill that establishes a state family leave pool. That's House Bill 2063. And House Bill 917 allows on the ERS, allows one ERS board member to be an elected retiree. But this does not guarantee that a retiree is on the board. It merely says that going forward, one of the 6 of the 3 elected members, 6 members total, but 3 elected members of the ERS board can now be a retiree. That has been signed by the governor. TPEA did support that bill, as it did the feds, in fact, testified on behalf of the 2 bills I just mentioned. Additionally, we provided support for Senate Bill 22, which gives a workers' compensation benefit to state employees who contract COVID at their jobs. That just kind of expands the unemployment compensation benefit. Senate Bill 44 was signed into law. It expands the authorized leave for state employees voluntarily serving in various organizations during disasters. So up to this time, it's just been Red Cross that's been singled out. And now this expands that list of organizations for which authorized leave is given to state employees during disasters. Senate Bill 483 requires some reporting on investment performance biennially to the legislature by ERS and TRS. Those are the bills signed into law. And of course, the big one we're waiting on is, we're waiting on the appropriations bill, but the House Bill 2 this time, unlike most sessions, is probably as important as any for state employees, because it contains a provision that provides effective upon this bill being effective this summer, would provide with the governor's signature or becoming law without his signature, would provide $1.05 billion in additional state money to the ERS pension fund. This is an amount the ERS actuary has indicated will move us forward in paying down the $15 billion debt. And this amount would be, I'll talk about in a minute, Senate Bill 321. This amount is contingent on passage of or enactment of Senate Bill 321. That amount would be available to ERS on top of the 10% of employee pay that the state already puts in. So that would be a multi-billion-dollar commitment on the part of the state going forward for the pension fund. The Senate Bill 1, the appropriations bill, has some really good news because it contains over $4 billion for the ERS insurance plan. And ERS's board just met, set premiums for next year, set the benefit design of the insurance plan for the coming year, starting September 1. And there are no benefit changes. There are no deductible on the medical plan, no copay increases, no co-insurance increase for the insurance plan, and certainly no premium increases, so that you will see going forward as a result of this $4 billion that's in Senate Bill 1. Now, that again has to be signed by the governor, has to pass or be allowed to become law without his signature. But he's given no indication that he would veto the entire appropriations bill. The other thing is that I don't mean to say the other thing, but it is so important. Senate Bill 321 was the primary TPEA focus all session long. And this provides, as I said, a pay down of the almost $15 billion debt that ERS now has. And it creates a program whereby every 2 years, the LBB would direct ERS in their budget request, in their legislative appropriations request, to not have to make an exceptional item, to not have to ask for additional money for the pension fund. It would assume in the base budget of ERS, every biennium going forward for the next 15 biennium, for the next 30 plus years, that ERS would be given in the base budget this additional $1 billion or thereabouts as determined by the actuary. Now, the good news is, additionally, if this is done, this moves ERS's fund towards actuarial soundness below a threshold of liability that's going to be such that there is some reason in a few years to believe, to think that the ERS fund would be authorized under statute to provide something they have not provided in over 20 years, and that is a 13th check or an annuity adjustment of some type. And that will be great news for retirees, just great news. So we are hopeful in that regard. But in addition, the bill creates a plan for future employees. The new plan that you may have heard about that this bill would create does not affect, let me repeat with emphasis, it does not affect the benefits of current employees. It only affects those hired after September 1 of 2022. Only employees hired after September 1 of 2022 will be in this new category 4, group 4, tier 4 of ERS retirement benefits. This would be what's called a cash balance plan. It is similar, very similar to the plan, the defined benefit plan with a guaranteed lifetime annuity that's already available to 253 of the 254 counties that have employees all across the state of Texas. and about 75 to 80% of all the municipal employees. They've had this plan for over 20 years and are very, very satisfied with it. It is, again, a defined benefit, guaranteed lifetime annuity plan. It's just figured on a different basis. And it guarantees in any given year a minimum of 4% increase in an employee account. And it never, so the employee account would never go below a 4% increase in any given year. And the employee account would be able to grow to a 7%, up to 7% in those years in which ERS investments perform well. So the monies for this retirement benefit would still be professionally managed, pooled in the ERS fund and invested by ERS with an expectation, as ERS has put into their actuarial assumptions, that there would be a 7% return in every given year. So there'll be a lot of years in which this account will grow more than that 4%. Additionally, once someone retires under this plan, investing is somewhat sooner under this plan, under this new plan. Once someone retired, they would be able to see their benefit, their pension benefit, grow in any given year in which the fund experienced more than a 4%, in other words, something close to 7% return. So that would be a sort of built-in upward adjustment, inflation offset, if you want to call it that, for the pensions of those retiring under that plan. So that's Senate Bill 321 is a major bill that the TPEA has really done everything we can to support. We've enlisted a coalition of other groups. We've written the governor, repeated, and we've written every legislative leader out there. So we ask you, we've asked you in a newsletter and various other ways to contact the governor's office and to ask him to go ahead and approve the bill, whether he signs it or lets it become law.
Right. We got an interesting question coming in on 321, and I want to ask this question because I've thought about it in the past couple of times we've talked about it. This particular piece of legislation sets in motion multiple payments over future legislative sessions, correct?
Correct. In fact, it has a provision, as I said, that would require LBB, when they give their budget directions to ERS before every session, to include in the base budget this additional money, this additional $1 billion plus for the biennium that was coming up.
So this particular bill, if the governor signs it or leaves it alone and it goes into law, it would actually force and require future legislative bodies to abide by it. So I mean, it's not something they can roll back, I guess. How does that work?
There is an argument that the legislature cannot completely bind future legislatures.
Okay.
That is a constitutional question, but what we have quite a significant precedent for this. And the precedent was that last session, previous session, 2019, the legislature put a similar provision in vis-a-vis TRS, the teacher retirement system. And so when TRS went to the legislature with their budget request this session, they did not have to ask for an exceptional item. They did not have to ask for an increased state contribution because it was already built into statute.
Right.
So that is why we think this is going to be something going forward that will be consistently followed by the legislature for both TRS and ERS.
Excellent. Thank you very much. So what's the best way that members on the call can help you if there's something at the last minute that needs to be notified folks on the Hill?
Well, we have, if you go to the TPEA website and go to advocacy, you will see that you can ask for us to give you a text alert too, but text the word TPEA to 313131, and we will let you know. Actually, that'll be something that'll be relevant to the special session, and I'll talk in just a second about that. But we ask you now to contact the governor's office, and in the newsletter that went out to all TPEA members, there is a link to contact the governor's office and let the governor's office know, let the governor know about how important it is that he allow this bill to become law, Senate Bill 321. So it is sitting on his desk as we speak, and it has been since June 1st. So that is something that could be done if you can either that or just look up the governor's office on the governor's website. The governor's office has a website, and you can just go there and communicate with them directly that way. But it is something you want to do, of course, with your own equipment on your own time, not on state time. So just a reminder. And but I wanted to mention real quickly that we are also not, we're not unaware that there was not an across the board pay raise given this time. There were some targeted pay raises given to particular groups of employees, especially in those agencies where they requested increases for certain groups of employees. And one example is maximum security facility correctional officers who are going, and custodial officers and law enforcement who are going to be given a 3% across the board raise, or even more than that for some law enforcement groups. But we are asking the governor's office we're asking the governor to include in the agenda of one of these special sessions an allocation for a pay raise, an across the board pay raise. As you know, there's not been one since September of 2014 was a 2% across the board raise. And since then, only through targeted raises and adjustment of the classification schedule have pay raises been given to state employees. So we are going to be pushing for that through both special sessions. And believe me, and we'll keep you posted. But again, text the word TPEA to 313131, and we'll be able to notify you when it's time for you to contact the governor's office regarding the need for a pay raise.
All right. Thank you, sir. Appreciate that update. And I know that you'll keep us posted and keep us up there. Real quickly, who AMBA is, we partner with the TPEA to make sure that you have the best gap coverage of all the plans that are out there. Make sure that those things that are changed, the things that are changing with ERS, that you've got availability for and access for those. But number one, our most important thing is to get more members for the TPEA. You can become a member, tell your friends, the coworkers, retirees. It's $250 a month. Anybody who wants to be an associate member and access the benefits, $2.50 a month, $7.50 a month for active state employees. The advantage of having benefits with TPEA and AMBA together, again, as I mentioned, Ray and Ann and several others on the ERS board, or excuse me, on the TPEA board who are members of ERS, they know that there are some gaps out there. Things change, plans changes. And so you can fill the gaps that aren't covered. They're portable if you leave state employment for whatever reason possible. You can extend your benefits to your parents and family members who are not eligible for state benefits. And we've done this webinar particularly for dental and vision. And I want to clarify this. By being a TPEA member, your parents are not eligible, or as a state employee or retiree, your parents are not eligible for your state benefits. Or once your child reaches age 26, they're not eligible for your state benefits. As a TPEA member, you can have access to the benefits through TPEA for your family members, dental and vision being one of those, long-term care for your parents, things like that. It's a great way to protect your family members, but it also could prevent you from having to take extended time off to care for a loved one that may have that need. Today, we're going to talk about the dental and vision plans. And so we want to kind of cover what ERS offers. The new plans are posted out there. Open enrollment is coming soon. Ray and I will start to change our focus from legislative issues this month into understanding and maximizing your state benefits and some of the things that are changing and the best ways to maximize those as we go forward. We're going to talk about the TPEA endorsed dental and vision benefits, share the differences, and help you make the most of your options. You've got some really unique options depending upon how you go about your benefits. I would encourage you to write this down. Write down this website, ers.texas, spell out the word Texas.gov. It's a great website. The folks at ERS are super. They've put together a very nice benefit package for you. You can look out there and check out the website for the comparison charts because there are a wide variety of different dental plans that are available out there, HMOs, network dentists, primary care dentists, things like that. With the ERS plan that retirees, state employees, and their families are eligible for, you have it through Delta Care, Delta Dental Care, which is a very large provider network. It's made up of two different types of structures. You've got network dentists, you've got primary care dentists that may be outside of the network, and then you've got a dental HMO, and the prices vary based on those coverages. You have reduced coverage based on out-of-network dentists as well. So you've got the ability to go see just about who you want to. Depending upon where you live in the state, your access to network dentists may be reduced. Your access to dental HMOs may be greatly reduced. So some of your options are limited depending upon where you live. There are certain waiting periods for certain services. Again, check that grid out, the comparison chart on the ERS website. It's very important that you understand those. You have your specific enrollment period. So if you don't enroll during open enrollment or within 31 days of becoming an employee of the state, you have to wait until the next open enrollment period. We're going to talk about the TPEA differences in that. Again, we've also mentioned this, that your eligibility is limited to you as an employee, a spouse, or dependent children under age 26, with some limited circumstances for special needs children as well. So that's a basic look at the overall ERS program. Pretty standard program. What I do want to do is kind of compare it to the TPEA program.
John,
Yes,
we
sir.
do have one request that we put the ERS website in the chat box.
Okay. All right. I will type that in the chat right now for everyone. That way you can see that. It is ers.texas.gov. And so it's a pretty simple website. You can just, if you want to go to Google search and type in ERS Texas, it'll pull up the website or the place to go and type in there. Again, the ERS folks are great, really easy to follow website. If you're an active employee or if you're a retiree, there's different places you click on, things like that. Very easy to understand. So now we're talking about the TPEA endorsed option or supplement, depending upon how you choose this. It is through Emeritus, which is an extremely large provider of dental care. You have the freedom to choose whatever dentist you want to work with. I met with a new TPEA associate member just a couple of weeks ago in San Antonio. He chose to choose the TPEA dental because his retiree plan did not have the dentist on there anymore that he used to go to. So it's an option that if you like the dentist you want to go to, you've got freedom with the TPEA plan. You can also enroll whenever you want to. So if you missed an open enrollment period and you need work, you can jump in. You're eligible the first month after enrollment. There's no long-term contracts, anything like that. Parents and adult children of TPEA members are eligible. Again, they would have to get their own plan, but they're eligible. So if you're a state employee and you've got dental, and then you've got a child that's 26 years old and has a job but doesn't have dental benefits, they could get their own plan. Grandchildren the same way. Susan asked, are grandchildren eligible? Absolutely. Now it's important to understand, Susan, they would not be eligible under your plan because just like any other insurance plan for the household, it is parents and children under 26. But if you got your grandchildren a plan through their parents, then they could have coverage as well. You can extend, that's the benefit of being with TPEA. You can extend your benefits to those family members there. We have a 2-year rate lock program, and there's a really unique rewards program. And I'm going to point this out a little bit because it's something that is not hard to understand, but once you get your head grasp around it and you need dental work, it can really be a money saver for you. And then we're going to show you a way for you to double dip as well. So let's go ahead and jump in here and look at some of the coverage levels here. This is your TPEA endorsed plan. Now you'll notice in the first year, there are some limits to coverage in terms of percentages, but you'll notice you've got your type 1, type 2, type 3 types of services there, in and out of network coverage. After the first year, it's all 100%, 80, 50, pretty standard. In the first year, there is a little bit of a cap on the coverage, but again, that's 70% of the overall out of pocket. You see down there, orthodontic services, there's a $1,000 lifetime max. Coverage comes in after 12 months in the plan. You get a maximum of $1,250 per calendar year. There is a $75 per calendar year deductible. It is waived with your type 1 services like your cleanings, exams, x-rays, things like that. It's a pretty straightforward standard plan. Somebody asked about extending TPEA benefits to siblings. Again, yes, it's available. It wouldn't be off of your policy, but it would be, they would have to get their own policy as well. And by being a TPEA member, you could help do that for them as well. Okay, good question. So that's where we see a lot of individuals participate. This is probably the most popular benefit of any of the TPEA endorsed benefits is the dental and vision plan. So this is where you see what the plan looks like. Now I want to talk about those rewards. Emeritus and TPEA want you to use your dental benefits. Most studies will show that good health comes from good oral hygiene. So we want you to go have your dental exams. We want you to have your routine cleanings, things like that. If you use your dental benefits in 1 year and your total for a benefit is under $500, you can qualify to carry $250 over the next year and then add that to your maximum out-of-pocket benefit or maximum benefit. So if you do it 1 year, it's $1,500. You can get carry over up to $1,000. So you could have $2,250 in benefit after a certain period of years that if you needed significant dental work, you could use coverage for that. So again, it's a great way to save up. I'll show you how that works here. Say you have a routine exam or a cavity filled in this year, cost $94, whether it's paid at 70% or paid 100%, whatever that number is, just if you have a claim that's under $500. Your maximum annual benefit, and I apologize, that number is wrong. It's $1,250. It's not $1,500. I put my math wrong on there. It's $1,250. You would add the $250 on top of that. You'd have $1,500 into rewards for 2022 into coverage. Again, you can carry over a maximum of $1,000 after 4 years, get you $2,250 of coverage in a given year for that. So it's a great way. No other program I've seen out there has a rewards program. It's just a super way to save up that money, still get coverage, still get your routine cleaning, still have your regular oral health. But if you know you're going to have some crowns or root canals or partials or something that's pretty heavy dental work, it's a great way to carry forward some money and put that money into your pocket in the meantime and save that money for future savings, for future coverage. One of the ways that TPEA members take advantage of their existing state plan and get coverage from TPEA because they can double dip. Dental is a very unique type of program that you can take and use your ERS benefits, file that way. And if you've got the TPEA plan, you can file that way. So you've got, I don't want to say double the coverage because you may not have exactly the type of coverage, but you can double dip and file on both plans, coordinate those benefits. We've had many members that say, hey, I have my state benefits, I'm going to keep those, but I know I've got to have major dental coverage, major dental work done. So they'll purchase this plan, become eligible for it, and then use that benefit as well. So it's a super way to save money, get this coverage. Again, you're not locked into long-term contracts. We have a rate lock for 2 years. So it's a super way to get your dental benefits taken care of as well. So we'll talk to you in a moment about how to get information on the dental benefits, who to call, where to get that taken care of. We've got people waiting on the phone that can help you out as well. I want to jump in and look at the TPEA vision benefits, talk about those as well, because oftentimes people will package these benefits together. You're going to see ERS come out with their plan, a very solid plan. We're going to show you some of the differences and highlight those. I think we heard, Ray, that ERS is actually going to go down in their vision premiums this year, starting in September with their plan. So highly encourage you to use this benefit. It's something that as kids go back to school, whatever you need it for, use your vision benefits because it's very important there. VSP is the vision provider for the TPEA benefits. That's the network. It's an extremely large network. Superior Vision Network is the state ERS plan. That's their network. We're going to show you some side-by-side comparisons in a moment. With VSP, probably the largest, if not one of the largest providers across the country. Tons of doctors all across rural metro areas Walmart, Costco, Sam's, those type of things, places that you can do your one stop for get your vision exam, and then get your prescriptions for fill, things like that. You get a covered 100% well vision exam every 12 months. With the state plan, there is a copay for that. We'll talk about that in a moment. Then you've got frames every 24 months, prescription eyeglasses with the copay. Lenses are covered every 12 months. No copays for the lenses. We'll talk about that as well. Show you a comparison between the state plan as well. Contact lenses, you've got an allowance for those, a little bit less than the state, but we'll show you what those things are. Additional glasses, sunglasses, more savings on that. The biggest reason that people get the TPEA plan is because it covers LASIK surgery. It's not a full coverage piece. It's more of a discount off of LASIK surgery. But we've had several members in this plan that get the plan because of the LASIK benefits. And so if you're considering that, I don't believe the state ERS plan provides LASIK benefits or even a discount off of it. This gives you the ability to get that if you're considering that procedure. Here's a couple of quick plan comparisons. Now the green one there, that's the one you go out to the ERS site. The one on the left-hand side, go out to ERS, take a look at that one. It's actually got a complete spread out there. This is in-network coverage. So if you're using the Superior Vision Network coverage, you see your routine eye exam, your copays, all the way down your frames, your allowances, your lens copays as you go down through there. And then you see the contact lens allowance of $200. The VSP plan, this is the TPEA plan. If you go to a network provider, and again, you go to any Walmart, that's a provider. So they're just about anywhere you can find them there. All your exams are covered in full. Your single vision lenses are covered in full. Your frames, you have a $150 allowance, and your contacts are $150 allowance as well. So a little bit less allowance, a little bit more coverage on the lenses. The exams, there's no copays. Out of network, you get allowances up to a certain amount. So pretty standard across the board. That's just a little bit of the nuances that are out there. Again, I highly encourage you, go take a look at that ERS website. It is great for understanding your benefits. Ray and I are going to spend some time with you over the next period of months and weeks talking about what's out there, how to understand it, that kind of stuff like that. I do see, Paul, a question on double dip on vision. You know, I have never had anybody bring that up. And so I'm not going to tell you yes, no. They are two totally separate plans, two totally separate providers. I will ask my expert, Marissa, back in the office on double dip on vision, and we will put that out. We're going to post this recorded webinar on the TPEA website. When we do that, we will also put in there somewhere an addendum or a note about double dipping. But Paul, I'll get your name, and if I find that answer specifically, I will send you the response. I will send you that response. That's a great question on double dipping on vision. I've never had anybody ask that, so I will make sure that we get that answered for you. Out of network benefits, if you do happen to find somebody that's not in the VSP network, which I'm very surprised if they're not, you do get, like as you see here, you get your coverage, your levels, or your allowances up to a certain amount. You see the rates over here. These rates, I will tell you, they are higher than the state provided rates. But if you don't have vision plan, or you don't have it for your kids, your parents need it, something like that, again, this is a great program for you to get involved as well. So you see the dental plan opportunities, you see the vision plan opportunities for you. A couple of ways that you can get your questions answered in regards to someone to sit down with you over the phone, Zoom, in person if you want to cover your benefits. You can call 866-643-0030. We've got representatives standing by that can answer any question that you have about your vision or your dental options from TPEA. You can use your camera phone or camera feature on your cell phone. If you want to open that up, hover over that QR code, and I'll leave this up here in a moment as we finish up to cover that. And you can hit a quick little form will pop up, fill out that form, check anything you want to talk about. We'll be glad to help you out on that. Penny asked about ophthalmologists and cataract surgery. There are separate limits for those. The biggest thing that you get in there, Penny, with the VSP plan through TPEA is if you go to an in-network, it's usually discounted savings. So it's not necessarily money towards those services. It would be like the LASIK where you would get percentages off of that coverage or off of that service. So from that standpoint, some of those also lean over on the side of your medical plan as well. So there's coverage on that side, possibly for the cataract piece as well. But a lot of those particular services, discounts are there as opposed to coverage for lack of a better term. So I hope that answers your question that way. And I see it. Susan's asking about benefits related to low vision assistive technology. That's another one. I love getting stumped on questions like this. Low vision assisted technology. Usually those type of things are related to medical plans, but I will see if there's any type of a discount that's available out there for that, Susan, and I will respond back to you specifically. That's an interesting question. Thank you very much. All right, and Penny, I will respond back to you specifically as well whenever I find out about the ophthalmology and cataracts. So this is the way that you can get a hold of us. If you want to talk to someone right away, 866-643-0030. Use that QR code on your cell phone. I'll come back to that in just a moment. Give you the opportunity to, I'll leave that up as we wrap this thing up. Couple of notes. We've got several more virtual webinars coming up over the next several months. We're going to delve in right before 4th of July, talk about the cost of cancer. Ray's going to share his own personal testimony and how that impacted him. We're going to bring back on the 16th the extremely popular membership perks webinar, where we talk about all the free stuff, all the discounts, the fun stuff that comes along with TPEA membership. Then we're working on something that I'm really excited about with Ray and Ann. We are going to bring to you kind of a pre-retirement webinar, or what they don't tell you about retirement. We have many of our TPEA members, many state employees that retire this time of year or start to do their planning over the next year or so. And we're going to kind of give you a behind the scenes look at what retirement looks like, what they don't tell you, what you should know, all those things that retirees who've gone on before you say, I wish I would have known this. So we're going to talk about that. On the end of July, we're going to wrap up the month with a conversation about emergency medical transportation in the state of Texas. It's crazy. It's out of control. We're going to talk about that and what the TPEA solutions are out there for that. And then in August, we're going to bring a long-term care 101, a basics conversation, and then a long-term care 201. We're going to get deeper dive into what happens if I need care after a knee replacement surgery? What happens if I have a fall? What happens if mom gets early onset dementia? How those things work. So we're going to delve into it a little deeper. One thing I want to point out, when you register for these, Hannah will send you out your email alerting you to register for these. Make sure to check your spam folder. Sometimes we've noticed that spam folders will hold up the registration link or your confirmation link. Also, too, please register with your personal email address, because I know certain state agency email addresses do get stuck right in that spam filter. And so we want to make sure that we're most prudently using the state resources. So if you want to register for these, please use them using your personal email address here. Okay.
And John,
Yes,
one
sir.
thing that's come up before, and I think we've got a question today, is all of these benefits, all of them, and there's several of them, a whole bunch of them, are available to TPEA members, but you have to be a TPEA member to enjoy these benefits. So yes, you do need, if you're not a member now, if you're on this call, please consider joining TPEA to take advantage of some of these wonderful supplemental benefits.
Absolutely. It's not. TPEA membership is not automatic as being a state employee. I'm going to show you here in a moment a way that you can email me. You can also use that QR code to get back to us, and we can help you with your membership enrollment, get you squared away about that. This is the best way for us to grow TPEA. Is for you to tell your coworkers, tell your friends that you work with, retirees, state retirees, about these benefits and about these Lunch and Learn series, to understand what's out there, the issues that are out there, and how that we can take care of those for you and how the TPEA can support you as well. So again, here is the phone number to call. If you call that phone number, you can become a member that way as well. 866-643-0030. You can use this QR code. I'm also going to put in the chat, I'm going to put my cell phone number, or excuse me, my email address. It's john.green@amba.info. john.green@amba.info. And if you want to send me an email that says, hey, I want more information about becoming a TPEA member, or I want to talk about dental vision, I want to know what all you have, that kind of stuff like that, I will get you connected to anyone within our organization, get you connected back to the folks within TPEA. We can take care of you becoming a member, because there's nothing more important than making sure that your voice is heard. And that way, when Ray and Ann and the crew go up to the Capitol and say, we've got 10, 20, 30,000 people behind us on a particular legislative issue, a benefit issue, that kind of stuff like that, your voice is counted in that. So again, help us out and we'll be glad to take care of you. I will wrap it up if there's not any other questions. I appreciate those of you in the chat, those of you who've joined us. Ray, thank you very much. Y'all have a great weekend. Don't forget Father's Day is this weekend. If your father's still around or father in your life, make sure that you honor them. And we will see you all within a couple of weeks. I'll leave this up if you want to, again, use your camera feature on your cell phone to start the process. There's a phone number there that you can call, all different ways that you can get a hold of us. We'll be glad to take care of you. Again, thank you very much for being here. Have a great rest of your week and a great weekend, Ray. Y'all take care.
Thank you. Thank you, John. Thank you.